22 minutes before 7. Thanks so much for watching Morning Live. Now, the National Command Council has approved the reopening of schools specifically for grade 7 and 12 starting on the 1st of June. And teachers are expected to report to their schools on the 25th of this month. Basic Education Minister Angie Motshekga made that announcement last night following consultation with stakeholders including unions, educators and support staff. Health guidelines will follow. Classrooms will be cleansed, they will be sanitized, learners will be screened daily and provided with 2 reusable masks. The department is also working on a revised school calendar that will be gazetted shortly. But Professor Brahm Fleisch, who is from the Education Policy Department at the University of Witwatersrand, joins us now to discuss some of these developments. Professor, thanks so much for your time. Welcome to Morning Live.
Good morning and welcome to all your viewers.
Now, Professor, starting off with what the minister had to say, she said things like, children are children, they will play. Schools are good for children. And listening to all of that as perhaps a prelude to what was to come, do you think the minister managed to communicate the necessary information and detail needed satisfactorily to parents?
I think the minister has a couple of very important different functions in her communication. The one is to be clear and succinct. Too much information will overwhelm people, and I think she found the exact right balance of indicating what needs to be done, but not necessarily overwhelming the public with details in this particular forum. So I think there will be details provided by the department, but I think she's communicated really important information. She's said to the parents and to the teachers that she is mindful of the huge anxieties that many, both parents and teachers have about returning to school, that this is a time of heightened emotions, of anxiety, of fear, of uncertainty, and that we need to be tolerant and we need to be patient with each other during this time. So I think that's a very important part of what she needed to say, and she did that very effectively.
Professor Fleisch, just scrolling through social media and looking at what parents had to say, there was a specific question that kept coming through, and that pertained to which data and which experts were used to inform yesterday's decision. Are you privy to that information?
I am not, but it certainly, she said in her speech that whatever information it was refracted through the Department of Health. So she has an obligation to work not just with experts in general, but specifically with the Department of Health, which is leading the response to the COVID virus epidemic.
So looking at where we are and just sticking with the question of what informed this particular decision, we look at what's happening across the world and following examples in other countries. We take a country like France, for example, who've reopened their schools, and within the first week, or should I say, of reopening, they recorded about 70 cases of COVID-19. And then you also have a situation developing across Europe and in North America where there are now talks about some syndrome, the Kawasaki syndrome, that seems to be COVID-19 related, also affecting children. So with all of that information also coming at parents through news and news agencies, how do we allay their fears that this is indeed the right thing to do, to send children back to school?
So I definitely think that these are things that we need to pay close attention to. But we also need to be aware and to listen to the experts that have been informing our discussions in South Africa. And I think that overwhelmingly, from what I understand, the experts are suggesting that children in the vast majority of cases aren't necessarily at the level of risk that older people are, and particularly people who have comorbidity issues. So I think that we need to be looking at that, but I think internationally there is clear evidence that most systems are beginning to reopen the schools. My son is a teacher in Japan. He'll be returning to school on Monday. So across the globe, people are returning, or children and teachers are returning to schools. And I think many countries are monitoring the potential impact on children, but across the globe, I think the consensus is that it is the right time to begin to reopen schools.
Speaking of comorbidities in children, if you take our situation here in South Africa, where there is a great deal of poverty in especially the poorest of the poor schools, how do we know that there is sufficient evidence to suggest that we are not going to be doing more harm by sending children back? Because the question then becomes, Professor, how many children have we actually tested to base these assertions that we are making on?
Okay, again, I'm an education person, not a health person, so I'm not the best person to answer questions related to children's health. So all I can suggest is that we follow what our experts have been saying, and particularly we recognize that the Department of Health has been consulting widely the virologists and the epidemiologists and decisions they've been taking. And I think the Minister has followed the Department of Health's recommendation about reopening of schools. Obviously, we need to be very vigilant. We need to be tracking these decisions, and we need to be tracking the hotspots very carefully, and we need to be looking at not just what's happening in South Africa, but what's happening internationally when we reopen schools.
But parents are thinking, there needs to be some logic that informs this decision. And if we look at what's happening right now in South Africa, we are seeing the numbers rising and rising drastically. We report on those every day. And the Deputy Minister has much, conceded that pressure also came from the fact that learners from previously disadvantaged schools are being left behind, while those from more affluent schools are continuing to study. Could this be one of the main factors that led to this decision, as opposed to one that is purely based on the scientific trajectory? Professor?
Again, I need to be clear that I am not a health scientist. My area of expertise is in education policy, but I suspect that the department took very seriously the evidence related to health issues before they made this decision. So again, I cannot really comment on the details of that. That's not my area of expertise, but I don't believe that the department would have taken a decision unless they had been very well informed about the health issues related to reopening of schools.
And then if we
I think we could trust,
No, please
trust
conclude.
the department has the best interest of children at heart. I think there's every reason to believe that the minister has listened to voices very carefully, has considered the various options, has listened to our best experts in the field, and have taken decisions based on the evidence available to her at the time. It's not that we won't be revising this on the basis of information that becomes available, but I do think that there has been substantial in this issue.
And then looking again at the reality in South African schools and the availability of water and sanitation in some of these schools, this was acknowledged as a challenge up front by the department itself. And if these challenges continue, is it correct for us to then model what we are doing in South Africa and what's happening in first world countries?
I think that there are definitely challenges. There are schools, we know there are schools that do not have adequate infrastructure, and there are a significant number of those. But I don't think we could wait until all infrastructure issues are resolved before we address the need to go back to school. I think we need to be much more proactive in making sure that where water, for example, is not available, alternative strategies become part of what the department does. And it does mean that school management teams and communities need to be particularly vigilant and be forthright when the basic infrastructure is not delivered. And then we need to be flexible to be able to say, well, in this instance, in this particular locality, we need to be thinking about closing the school until such time as the necessary basic health infrastructure is in place.
Now, Professor, the Minister also spoke about teachers receiving training before the opening of schools, saying that learners will be screened on a daily basis, the schools will be cleaned, they'll be sanitized. How practical is all of this as our situation pans out right now?
I think we need to recognize that in the first instance, we're not seeing all learners coming back. So we're seeing only one class in the high schools, the grade 12s, and then in the primary schools, the grade 7. So it's definitely viable for the first instance because the number of learners coming back to schools is going to be relatively limited. As the number of learners increase, the challenges of managing the screening obviously increases. But I think the fact that we have a phased opening of schools makes it very viable to actually manage that process effectively.
And of course, as the Minister said, children are children. They will play in the playground, in terms of social distancing within the classroom setup. And as you say, it is a phased approach. But again, the practicalities of all of this, given our reality in South Africa, again, especially in the most disadvantaged schools, Professor.
So again, I think that the anxieties that you're expressing, and I think that there are anxieties that hundreds of thousands of parents have about whether this is going to be an effective working solution, are real, and I think we need to acknowledge it. But at the same time, I think the department has put in place a fair and reasonable plan that allows us to monitor how the process is working, to be flexible in the event that challenges begin to emerge. And I think we need to go with the process and trust that the process will, obviously with careful and systematic monitoring, will be part and parcel of how we manage the transition to a full working society, including a full working school system, which we need to have. It's a part and parcel of our viable democracy.
But right now, at least anecdotally, parents seem to be very worried, and there seems to be a very real possibility of some parents refusing to send their children back to school, Professor. We've seen this in countries like Denmark as well. So what happens if parents then decide not to send their children back to school? What do we do in terms of making sure that everybody is at least not, left behind, or at least most of the children not left behind in terms of trying to get work done for the remainder of the academic year?
So again, I think this is a process of flexibility. We need to recognize that some parents will be very anxious, and we need to be patient and tolerant of parents who are experiencing heightened levels of emotions around this time. Our children are our most precious resource, and I'm deeply sympathetic to parents who are so worried about this. I don't think we should be dismissing them and suggesting that they are inappropriate. I think it's really important that we really recognize their value, but at the same time, we need to have the system moving forward. And in the process, I think it's really important to allow for flexibility. So when kids do come, and they may have come a few weeks later, to be able to address the backlogs that those kids have for coming a little later into the school system.
Well, Professor, we're going to have to leave it there. Thank you so much for your time this morning. Professor Brahm Fleisch speaking to us here about what Minister Motshekga had to say last night. He is, of course, Professor of Education Policy, talking to us about the reopening of schools, which starts with grades 7 and 12 as of the 1st of June.